Welcome back to San Antonio Living. This morning we're talking about senior care. There's a special place here in town that really caters to seniors, and Dr. Rosa Vizcarra is joining us this morning. She's a family medicine physician and a geriatrician with the Nix Senior Health Center. It's nice to see you.
Thank you for coming. Thank you for having me.
Let's talk about the Nix, first of all, because they're in the heart of downtown, and I know they've got a very big commitment to the community as well as the senior community.
Absolutely, yes. They've been there, very well known in San Antonio for a while, and retaking this kind of project for seniors and revamping the senior care and about the location where we can have, labs, x-rays, things that we need right there. Or even if our seniors need to be in the hospital, from our clinic, we can just do it straight from there to the floor, and very, very accessible for the patients and doctors.
It's very important if you are taking care of an older parent, or if you're still caring for yourself and you're in your own home, that's accessible and easy to go to one place, see one doctor, have everything done in-house, and that's what the Nix Senior Health Center is all about.
That is correct. Yes, we do have a number of specialists, other specialists that if we need them, orthopedics, cardiology, pulmonology, critical care, everything is just right there, and we have great communications, and it's a small place, but it's not, you don't get lost,
right.
and it's very user-friendly for patients and doctors.
What if you have to move your elder relative to another facility, like an assisted living area? Can you assist with that?
Absolutely. Our main goal is to provide a comprehensive care for seniors, not just their medical needs, which, blood pressure, stuff, heart issues, but their psychosocial issues. Most of the time, that's where a lot of intervention is needed. They're no longer able to take care of themselves at home. They have a little bit of an issue, paying the writing checks, or they're being forgetful, they're starting falling, they've been in the ER 3 times in the last 6 months. So all those things, we perform a great assessment, we call the geriatric assessment.
Okay.
And then we do provide guidance through all these processes. Do they better off moving to an assisted living facility? They can provide services, or other kind of facilities where they can be better served, and then we can follow them to on those facilities. My partner and I would go.
So this is like if you're at home and you have a care provider, but maybe you're running all over town, going to different doctors, and you're getting a little bit older, you may want to check out the Nix Senior Health Center and start your care now so that it's there for you as you age.
That's absolutely right.
Okay.
We are primary care physicians.
Okay.
We are primary care physicians. Geriatricians are doctors trained in either family medicine or internal medicine, with extra training in geriatrics, in the care of elderly seniors, on all these settings, nursing home, assisted living, hospitals, rehabilitation places. So we have that a little, extra click that it helps, and it goes long ways when you take care of seniors.
Let's talk about a couple of assessments. These are open to anyone. They are free if you get them done before December 31st. There's a fall assessment that you'll do at the Nix Senior Health Center. What does that do? Does that tell me when I'm going to fall, or because I fall a lot, and I'm still very young?
Well, and those are what we call screening. Falls is a great, it's very common, and it's of great importance in seniors, because they could be a sign of major issues, as we all know.
Right.
So basically we do a screening, and we have a very quick test called the Get Up and Go test, but we also have physical therapists that comes and give us more insight into their muscle strength, their quad strength, their ability to, on their arms. I mean, you need a lot of coordination. So it's basically a quick screening in which we can give further recommendations based on what we quickly find. The same thing for the memory. It's also a quick screening, and we basically review it and say, you probably need to look into something else, and come on board, or, go and see your doctor. But that's what we do.
Well, you know what, it's so important to be proactive. So if this is something that you're doing on your own, you may want to take these assessments right now. If you're taking care of an older person, this is a place to take them. It's the Nix Senior Health Center downtown on Navarro, also at 5307 Broadway. That's where they are, the Nix Senior Health Center on Broadway. The phone number is there for you if you've got questions, 568-5600. You can also find more at nixseniorsolutions.com.